Thank you for joining us for this session on integrative medicine. In this session, integrative medicine expert Dr. Shelley Latte-Naor will give valuable information about evidence-based ways to maximize quality of life during and after treatment. Dr. Latte-Naor is Director of Mind-Body Medicine at Memorial Sloan Kettering Cancer Center in New York. Thank you for joining us, Dr. Latte-Naor. I'll turn it over to you.
Welcome everyone to this Ovarian Cancer National Conference 2022 Integrative Medicine session. I'm Shelley Latte-Naor. I'm an internist and faculty member with the Integrative Medicine Service at Memorial Sloan Kettering Cancer Center. And the majority of my patient population consists of patients that have been diagnosed with gynecological cancers or breast cancer. And so the diagnosis of ovarian cancer has always and is very near and dear to my heart because I'm following many patients with this diagnosis, and I'm fielding their questions about integrative medicine. So I'm hoping the next 40 minutes or so are going to give you a little bit of insight into what I do and what I speak to with my patients. So first things first.
It's all okay.
Let me see. No comments not forwarding.
That is the worst.
Okay, no, it did. So first things first, I don't have any disclosures. And just to give you an overview over the next 40 minutes or so, I'm hoping to clarify some definitions and give some explanations about the variety of terminology that is used in this field. There is a lot of complementary holistic alternative that is thrown around interchangeably, and we're going to try to bring some clarity into that. I'm also going to speak briefly about communicating with your providers about integrative medicine. And then we're going to look at different integrative modalities from the viewpoint of how they can be an asset in managing stress and achieving resilience in the face of a cancer diagnosis or in recovery from a cancer treatment. And then we're going to finish with a section on the use of supplements in the cancer setting, and I'm hoping to teach you some tricks there. So let's start with defining integrative oncology. And the Society for Integrative Oncology has published a definition that I think is very comprehensive and is a great start into our session today. So integrative oncology is a patient-centered, evidence-informed field of cancer care that utilizes mind-body practices, natural products, and or lifestyle modifications from different traditions alongside conventional cancer treatments. Integrative oncology aims to optimize health, quality of life, and clinical outcomes across the cancer continuum, and to empower people to prevent cancer and become active participants before, during, and beyond their cancer treatment. So that gives you an overview about how we see our role in this field. But as promised, let's look at terminology, because I think that's where it gets very confusing for patients and providers alike. From our perspective, integrative medicine, the way we define our role in cancer care, we see it as a supportive service that is mainly aimed in supporting patients' symptom needs, right, for symptom control. And it's meant to be used alongside or complementing the standard of care, conventional care. We have an emphasis on really utilizing the best available evidence in order to prioritize our patient's safety, right? So the safety data, the available evidence is taken into account first and foremost. In contrast to that, much of what we would define as alternative medicine is often promoted to be used instead of conventional care, and is often touted to be curative, a cure for cancer, kills cancer cells, or addresses the cancer diagnosis directly rather than symptom management. And these are often unsubstantiated claims that have not been really well founded on research. And hence, they're potentially risky because there's a lot of lack of safety data. And often they're also very costly for a patient. So I think clarifying these definitions is very important to really put a framework around what kind of provider you're dealing with. Let's look at the use of complementary medicine. So in this still one of the largest surveys that was sponsored by the NIH already 10 years ago, we see that complementary medicine use, and that includes integrative and alternative medicine, is fairly common, and that is a decade ago. So today, these numbers might be much, much higher. And we also see that natural products, the use of supplements, is the leading modality of complementary and integrative medicine. And that is something that we have to just pay attention to, and especially because many patients are using complementary and or alternative medicines without the supervision, the support, and the guidance of their medical team. The reason why many patients, almost half patients, don't disclose their use of complementary medicine to their team is maybe fear of dismissal, lack of perceived lack of support by the physician, or actual lack of support, perceived lack of knowledge of the provider, right? And that might really lead to unsupervised use that can be really affecting the course of somebody's, especially cancer treatment, negatively. There are other reasons, and one of the leading reasons, according to this survey, is that healthcare providers don't ask patients about the use of complementary and alternative medicine. So this is sort of my pitch to encourage you to speak to your team about your interest in alternative and complementary medicine, because you might get guidance, support, and resources that otherwise would not be available, and you could also really avoid adverse effects or problems down the line when these things are not disclosed and may pose a conflict with your treatment. And this is not lastly important, because there is really compelling data to say that the use of alternative medicine in lieu of conventional care, especially in the treatment of cancer, right? We're seeing here data on several solid organ tumors like breast, lung, and colorectal cancer. It seems to be harmful, right? So it's very well documented that leads to higher mortality in patients diagnosed with these cancers. So that's why it's something that I promote upfront, right? Transparency, lack of stigma, and communication about the use of complementary and alternative medicine in an evidence-supported and safe way. At the same time, there is accumulating data about many of these integrative modalities. So there is an explosion in interest by the scientific community in topics like meditation, acupuncture, herbal treatments, and yoga. And you can see here the number of publications over the past decades have really increased dramatically. And the way today I see and I explain to my patients the use of integrative modalities and sort of the whole person view on health and support of your cancer treatment is really about taking care of all aspects of our health, right? And sometimes I use the analogy of a house. Right, we know that to maintain a house, we not only have to pay a mortgage or a rent, but we really, have to imagine what would happen if we would start ignoring one area of the house. We would not sweep the floor. We would not bring up the garbage. We would not open the window to bring some fresh air. And we know what would happen to the objects that we live with if we don't attend to their maintenance in an ongoing way, right? So, so it's much harder to accept that when it comes to our bodies, that it needs the same kind of maintenance to all aspects, all rooms, right, of our health in order to really achieve resilience and longevity, right? And today there is good evidence to support the use of mindfulness, nutrition, exercise, stress management, sleep, the role of physical environment, relationships, and spirituality in overall quality of life and health. And so when we're speaking about wellness, it's really considering all aspects of your life and their role in your health and well-being. And that includes spiritual, physical, emotional, intellectual, environmental aspects. And when I'm saying wellness here in the center circle, that's not the kind of wellness that we seek in the spa, but rather something that's measurable, right? Quality of life, overall physical functioning, resilience. So that's how we see integrative medicine in our role at Memorial Sloan Kettering, that we are a supportive service that addresses symptom needs and also has a really important role in preventive health and lifestyle medicine for our patients. And these kinds of services are being offered increasingly at larger medical centers and increasing numbers of medical centers and cancer centers. And so what's really the significance for our patients? And I think one of the biggest significance is that we illuminate some aspects of the patient experience that are otherwise really not visible to us as providers, right? So looking at the slide, many of you may recognize a waiting room. And for me, that's symbolic of the blind spot that many of us have towards aspects of the patient experience. So patients may walk in through the door of our consultation room, but we are completely unaware of, the sweaty palms, the palpitations, the nervousness, the stress that often people go through as they're waiting to be seen by a new doctor, right? So I think that that's really one symbol of aspects of the patient experience that are often left unacknowledged, but have a significant impact on the quality of life for many patients, especially in the cancer setting. And so stress makes everything worse, right? If stress goes beyond the momental fight, flight, freeze, tend to befriend response that is acute stress, it can lead to hormonal neurotransmitter changes and really have an impact on our health with lasting changes on our circadian rhythm, metabolism, and immune response. And so many patients actually wonder if chronic stress has caused cancer. And if we were live here, I would maybe ask you to raise your hand if you have that suspicion that there was a stressful event or a stressful time in your life that has, in some form triggered the cancer diagnosis. I would say many of my patients suspect that. But has that been shown in research? So there is actually research that looks at cancer incidence and prevalence and tries to correlate it with perceived stress, reported stress, or even the survival of traumatic events. And so far, we don't have evidence that stress can cause cancer. We do know that stress, of course, impacts our lifestyle and our health behaviors, such as our food choices, our propensity and our energy to be physically active. It can trigger unhealthy habits, such as alcohol use and social isolation. So it does affect our health, significantly. However, how does it impact cancer? So since we know we don't have evidence that it causes cancer, can it have an impact on tumor growth? And for that, there seems to be some preliminary research in the laboratory and animal studies and also small human studies that may be an effect of stress on cancer growth. So can stress help cancer grow? And one of the studies that is most famously quoted is a study from Nature that has used actually a mouse model of ovarian cancer, where it was demonstrated that those mice that were stressed repeatedly, and they were stressed by social isolation or prolonged swimming, for example, those mice that were exposed to stress, the more they were exposed to stress, the more the cancer spread. And inversely, when those mice were stressed but given a medication that counters some aspects of the stress response, for example, slows their heart rate, then that cancer spread was slowed, right? So here, the impact of stress really was very poignantly demonstrated in this mouse model. So how that applies to our health is, of course, a question mark, but it raises the question about how stress impacts a cancer patient. And of course, a cancer diagnosis and cancer treatment is a stressor. So what do we do with that information, right? In reality, the majority of stressors that we are exposed to in and outside of cancer treatment are things that we can't really avoid, right? We have to face them, for most of us, daily, over and over again. These are not things that we can eliminate, our stressors. So, given that, I think it's important to realize two things. Number one, we're really built to sustain stress, and there is a level of stress that can actually be beneficial for us and allow our body to give us resources to really live up to the challenge. However, chronic stress that persists over time and really overwhelms our resources, even though we can switch off the stressors, we can think about ways to support our resilience and learn to skillfully deal and face these stressors. And so when I think about stress management in the cancer setting, which is really a cornerstone of integrative care in the cancer setting, I think about almost like a highway with several different lanes. Some of these lanes describe modalities that we know have an impact on stress management. However, I can't prescribe them, right? For example, time spent in nature, right? Or the supportive aspects of community, right? However, there are the more classic stress management practices, for example, mindfulness-based practices, most famously mindfulness-based stress reduction. The famous 8-week curriculum that is taught really all over the world has been shown to have benefits for patients undergoing cancer treatment. And we know that it helps patients with anxiety, stress, and fatigue, that can help just with general mood stabilization, with sleep quality, and just improving overall quality of life. Now, mindfulness-based practices have been awfully fashionable over the last decade. And it seems like sometimes everywhere we look, we see beautiful people cross-legged, blissfully, eyes closed, right? And we know, of course, mindfulness has saved Demi-Moore's life, right? But what does it mean for us? And what does it mean for treating patients in the cancer setting? So we also know that mind-body practices that goes beyond mindfulness, and we will go into it in a little bit more detail, have been included in the National Comprehensive Cancer Network guidelines for supportive care in cancer, right? For example, cancer-related fatigue, survivorship, anti-emesis, so dealing with nausea, distress management. All of these guidelines incorporate some form of mind-body practices. And now we also have fairly robust research that demonstrate the effects of things like meditation, different forms of meditation, but especially mindfulness, which is really defined as present-centered, non-judgmental awareness, on a variety of different outcomes like anxiety, depression, stress, negative affect. So this is a systemic review and meta-analysis that was published in JAMA that really found a beneficial impact of meditation practices of almost all these different outcomes. And they concluded that mindfulness meditation programs can reduce the negative dimensions of psychological stress and can lead to improvements of anxiety, depression, pain with moderate strength evidence. And that has really been demonstrated over and over again in a variety of cancer settings. So what does mind-body medicine or mind-body therapies, what does that include beyond mindfulness practices? So there is, for example, relaxation training that includes progressive muscle relaxation, guided imagery or visualization, deep breathing, and hypnosis. All of these provide tools to induce the relaxation response a little bit more voluntarily, right? In our culture, relaxation is when have taking care of the laundry, taking care of the dishes, we're dimming the light, things are done for the day, we're allowed to relax. But there are techniques with which we can promote relaxation, train and practice relaxation. And these include these techniques. Yoga, of course, is one of the integrative modalities that is very, very popular. And yoga really is not one thing. It's a collection of different disciplines that include a variety of different practices, from physical postures, but also breathing techniques, meditation and relaxation. All of these are sort of under the umbrella of yoga. And here we see our yoga therapist, Tina Paul, working with a patient. And I think what characterizes yoga is that there is spiritual and philosophical underpinnings that often for our patients seem to be a meaningful addition to their meditative movement practice. Tai Chi is another favorite of mine, especially for patients that are going through treatment, are experiencing fatigue, are limited in some way in their movement practice. For example, after abdominal surgery, right? Many of my ovarian cancer patients, they're really limited in their usual movement practices. They cannot do anything that strains the abdominal wall. And so movement practice that is slow, controlled, that avoids axial flexion, meaning bending and twisting, is really ideal for their energy level often, but also ideal in not straining the abdominal wall and still engaging in some resistance training, right? And also really fostering some of that coordination, balance, and strength that, in the peri-surgical period after surgery can really suffer. So for you to gain clarity about mind body therapies, I think this illustration helps. I divide mind body therapies into provider dependent. So you need a provider, a teacher, a therapist, and an appointment usually, and self-guided. So you can learn these techniques to use them by yourself whenever you want. So provider dependent, things like acupuncture, massage is really completely passive. And in some situations, that's what patients need, right? Where they don't want to learn a new technique or a new modality. And then if patients need to increase their movement practices because their functional status has changed, meaning they can't do the usual exercise practices, they can do something really modified only, then things like yoga therapy, Tai Chi are just wonderful. But if you want to tackle stress in a more focused way, then some of the more classic stress management practices are in order, right? MBSR, mindfulness-based stress reduction, or cognitive behavioral therapy, CBT, are some of the practices that are available almost everywhere, can be done online, and can be a real asset in dealing with stress long-term. And those that want to really practice inducing the relaxation response, there are other modalities that may be more appropriate. And so you can sort of judge for yourself what kind of need is most prominent for you and how to use these modalities accordingly. There are also ways to meet stressors in a way that doesn't require a lot of instruction or appointments, right? This is a research paper that was published in the Journal for Clinical Oncology. And this happens to be a study that was done in kidney cancer patients, and they were divided into two groups. One group was asked to write about their deepest emotions and thoughts alongside their cancer treatment, and one group was just asked to write about neutral topics. And when they were followed over 10 months of their treatment, we find that the patients that were instructed in emotional journaling, those patients seem to have a benefit in terms of their overall physical functioning, their fatigue, their physical symptoms. So this kind of support, even in journaling, is what we see has a potential benefit of stress management, where it has really an impact on various aspects of the treatment experience. So what does an integrative oncology consultation look like? So we may speak about things like diet and nutrition, physical activity, so lifestyle factors that have an impact on long-term risk. We'll speak about stress management, mind-body practices, and we often speak about the use of supplements and alternative therapies, for example. So how do we use natural supplements? This is a really highly requested topic in our lectures and in our clinic as well. Many patients have lots and lots of questions about the use of supplementation and herbal medicines and how they can benefit and be an asset to their treatment. And so the first thing we usually say is that vitamins and minerals, micronutrients should really be obtained through the diet, right? The majority of vitamin supplements are, can be just obtained through having a diet that is well balanced, that emphasizes whole foods, that emphasizes plant foods, that is low in concentrated sweets, but high in fiber and high in sources of omega-3 fatty acids. Now, of course, diet advice cannot be given undiscerningly to a group of people, because everyone has different needs, especially when it comes to recovering from surgery, when needs and recommendations might really vary widely. And some patients are shocked that they're advised to actually follow a diet that they don't perceive as healthy. But to allowing after surgery the gut to heal, sometimes having a low fiber diet can be really, really important. But beyond vitamins and minerals, how about botanicals? How about herbs? How do we make decisions about the use of herbal treatments and natural products? So the first thing that I like to share with patients is how we think about the use of herbals and their safety in the setting of cancer treatment alongside chemotherapy, for example, but also afterwards. So the first thing that we ask patients to do is just imagine all the different supplements, all the different botanical agents to be sort of put in one pile. And if we had to categorize them according to their level of evidence, they would fall into the shape of a pyramid. When just the tip of the pyramid would be what we would call category A supplements. Category A supplements are a small group of supplements where we actually think we have robust data to demonstrate their safety and their benefit. But that's a really small group of supplements. And that can also change according to what kind of medications you're on, right? And what kind of diagnosis you have. But for most, it's really a small group of supplements where we say there's good safety data, there's good efficacy data. And then there's a small category just below that, which is category B supplements. And these are thought to be safe based on the available data. However, we don't really know what they're doing, whether they're helping or not. So these are likely safe, but we're not sure about their efficacy. And then the whole base of the pyramid, the largest group and the majority of supplements really fall into category C, where we say we don't have robust evidence. We don't have sufficient evidence to neither document safety nor benefits. And that also includes supplements where we know about adverse effects, toxicities, and other problems, right? So I think asking the question about the available evidence is really the first thing we do when we think about adding a natural product to a cancer treatment or beyond that. And then the next question is, and this is a question that will also be pertinent for your treating oncologist, for example, is, can a natural product cause herb-drug interactions with whatever your medical regimen consists of, right? And herb-drug interactions can be varied, right? So there are many, many examples for herb-drug interactions. One very common way of interacting with medications is via the enzymatic route, right? So there is an enzyme family in the liver that is called the cytochrome P450 system. That's just a family of enzymes that breaks down and metabolizes many of the medications as well as foods that we're exposed to. Now, these enzymes can be actually sped up or slowed down with exposure to foods, for example, grapefruit juice, or other herbs can interfere with the metabolization of drugs via this enzymatic pathway, via influencing the rate at which these enzymes can break down and metabolize medications. And that can really result in an increase in adverse effects, as well as potentially even a decrease in the efficacy of the treatment. And if that's the chemotherapy treatment or another treatment agent that you rely on, that is, of course, really risky. And then with gynecological cancers, including ovarian cancers, we also want to be mindful of estrogenic potential, right, of herbs in some cases, right? So there are herbs that have qualities that are similar to estrogens. So they attach to some of our estrogen receptors and they can have an impact just like an estrogen. Examples are red clover, kuzuru, donquay, soy. These are all herbs that sometimes are offered to patients for the treatment of menopausal symptoms, which is also something that's very relevant to many of my patients with ovarian cancer. And so that is not always safe. Number one, because the phytoestrogenic action may or may not be appropriate. And number two, again, many of these herbs also can cause herb drug interactions via that CYP enzyme or other enzymes, right? So this is something that we have to be aware of. And really the third question is product quality. How can we ensure that these natural products are of high quality when really supplement companies do not have to prove that they're doing batch testing, right? So that leads to inconsistency, contamination, adulteration of products. And every year we get reports about adulteration of products and contamination of products. So there's a lot of variability when it comes to quality of natural supplements that we have to be aware of and that we have to mind, right? And hence it's worthwhile looking at the supplement label and really understanding it, which we're going to practice a little bit today. So yeah, so one other option in which we can have a downside from using supplements is that they can enhance certain adverse effects, like for example, acetyl L-carnitine, a very common supplement, can potentially worsen neuropathy under certain circumstances. That's just one example. There are several examples of this. So I'm sort of cautioning, starting off with these very cautionary slides in order really to educate about a nuanced and educated, informed approach to the use of natural products. And often the use of natural products really is based on the belief that anything that's natural really equals safe, gentle, mild, not harmful, not toxic. And yet it couldn't be further from the truth, right? We know that the strongest carcinogens are really found in nature, right? So there are toxins that can, for example, contaminate nuts or oats that are very common, that are some of the strongest carcinogens we know of. And then on the flip side of that, there are many medications, including chemotherapy agents, that actually go back to an herbal compound, to an herbal extract, right? Like irinotecan or paclitaxel, they go back to actually herbal compounds and herbal extracts. So for us, we really don't see this big divide into this is natural and this is a prescription medication, or this is a conventional treatment, but it's really a continuum. And natural products have, they attach to very much the same receptors as many medications do, and they can have adverse effects and cause interactions just like medications do. And so you want to be, again, really informed and educated about the use of them. And most importantly, we want to not be naive about them. We want to not sort of equate something that's natural with gentle and safe, and something that's conventional or prescription medications as potentially harmful and toxic. I think that that's really a fallacy that we have to get over to really utilize the power of natural products alongside conventional treatment fully. So let's go through a couple of examples. So one supplement that I get asked about a lot is graviola or pawpaw. And we're seeing here a picture of the fruit, which is delicious, and the juice is delicious. However, we know that the leaves contain compounds that can inhibit cancer cell, at least in the laboratory and in animal studies. And, there are some downsides to that. So many patients get very excited. They want to take it. Often they just buy the juice and unknowingly just, drink a lot of juice, which of course contains lots of sugar. It's delicious, but it's more of a dessert. Really the cancer inhibiting Action is expected to be in the leaves and the twigs of the plant, but it's also not without problems, right? It inhibits a certain protein that can, again, influence drug metabolism and cause or drug interactions. Beyond that, we have suspicion of neurotoxicity with the use of these leaves and twigs from this Graviola pawpaw plant. And so this is not something I commonly advise patients to take, at least not without really looking at the downsides, the potential interactions, and there are other treatment options, right, that we don't want to risk harming. Turmeric, something so common, right? We find it in our curry. It has this lovely yellow color. It's very, very common and something that many of my patients ask about. And indeed, in the laboratory and in cell culture, as well as in animal models and in small human models or human studies, we see that it may inhibit tumor growth. And there is some possible anti-cancer effect seen in pancreatic cancer and some gastrointestinal cancers. However, even something so common that is used in cooking can have an impact and side effects. So for example, it can thin our blood, it can inhibit platelet aggregation. So that's not something that I would want in patients that have a low platelet count or at risk for bleeding. It also can inhibit our good old cytochrome P450 system, exactly the 3A4 enzyme, which is very, very common, or a very common reason for interactions. And so this is something that also has to be used with caution and really well informed. Vitamin D, this is another supplement that we often recommend, especially because deficiency is prevalent, especially here in the Northeast, and deficiencies associated with higher rates in breast cancer, colorectal cancer, prostate cancers. And so we often advise to check levels just to see where you're at. We often advise to supplement. But it's also important to know that we have to be careful in the setting of kidney disease or calcium metabolism. When calcium metabolism is not normal, we have to be careful with vitamin D, even something so benign and so common like vitamin D, we have to be informed and smart about. Okay, so let's go into some exercises into how to read supplement labels. So you see here a supplement label for curcumin, which is a very common supplement that we just talked about, right? And we're seeing here that curcumin is listed as just, proprietary blend, and then it says curcumin 500 milligrams, but it doesn't tell us which, it doesn't tell us whether they went the extra mile to verify what kind of plant they're using, which part of the plant, and how it was processed. As opposed to that, this supplement tells us all of that. It tells us it uses the root. It gives us the botanical name to make sure that they know they have really specifically looked at exactly what plant they're using. And we know that it's a standardized extract and was standardized for what we think is the active ingredient, which is the curcuminoids. We see that there are various curcuminoids part of this complex. And we also see that the dose is a relevant dose, right? So most studies do use 1,000 to 2,000 milligrams per day. We also see something else that's important. So turmeric by itself is not very well absorbed. It has to be either modified in its structure, or it has to be given alongside something that will enhance its absorption, for example, black pepper extract. And here too, we see that they tell us the botanical name, they tell us which part of the plant was used, and this is the correct part. And we also know that this is a standardized extract for what we think is the active ingredient, which is piperine, which enhances the absorption of curcumin. So this is an example of a well-informed, well-laid out supplement fact sheet. This is the kind of supplement that I would say, this is something that can be used, especially if it was third-party laboratory tested. Let's look at medicinal mushrooms, which are very, very popular right now. So we see that various medicinal mushrooms are part of the supplement. We see that here, various mushrooms are contained in their mycelium, which is the part of the mushroom that grows under the ground. And some mushrooms are represented in their fruiting body or their fruit. And then there are a whole blend of mushrooms where we don't exactly know what part of the mushroom was used and whether it was standardized or not. right? So this is, I would say, insufficiently labeled. Let's look at this in contrast. So here we see turkey tail extract, which is something we often implement in patients when appropriate. And we see that this is one mushroom. We see that they went the extra mile to really tell us this is the botanical name of this mushroom, and it's standardized to what we think is the active ingredients, 35% beta-glucans, which would be appropriate. They also tell us which part of the mushroom was used, and it's a relevant dose, right? So again, this is more likely a supplement that I would consider using, especially again, if it was third-party laboratory or independently tested for its quality. So I hope that this is something that this little exercise helped. If you want to learn more about our work with supplements, we have actually a website that is free to use. It also is an app, a mobile app. It's called About Herbs, and it is a data bank where you can learn a lot about natural products and the research behind them. And so with that, I thank you for your attention, and I welcome your questions. And I'm so glad to have been part of this conference and wish you well.